Hi, this is Dr. Bernstein of Dr. Bernstein's Diabetes University. Today's session will be one of 4 on appetite-suppressing medications. The bulk of my patients, my new patients, have been overeaters. In fact, the bulk of our population, I would guess, is made up of overeaters. And this is probably the major cause of type 2 diabetes, but I find that even type 1 diabetics are usually overeating and craving carbohydrates. This problem of overeating is very difficult to deal with, and I've had to use a variety of medications to control it. The star for these 4 sessions is Samantha Flynn, mother of James Flynn, who is encyclopedic in her knowledge of the substances we use to treat overeating. Hello, this is Dr. Bernstein of Dr. Bernstein's Diabetes University. Today we're going to speak about substances used to curb food craving, and more specifically carbohydrate craving, because that's a major problem in the cause of diabetes and also in the cause of high blood sugars once you have diabetes. So I'll be joined with Samantha Flynn, my sidekick over here, mother of James Flynn. She is my expert on what we'll call anorexian substances, agents that curb overeating. Now, there are many of these things out there on the market. Some are highly advertised, some are not advertised at all. But none of them are going to work for weight loss or blood sugar control unless you follow a low carbohydrate diet. So we see claims for many of these substances to the effect that you can lose 5 pounds in a year, or maybe 5% of your body weight in a year. But these small reductions in body weight relate to the fact that the patients are usually put on high carbohydrate diets. Now, we're going to go down a list of substances. We'll start with the most likely to be effective. And in my experience, I've had a lot of experience with this over 30 years playing around with different agents. Now, the most success that I've had has been with the Incretin Mimetics, the class of drugs that are injectable and have been on the market for about 5 years for the purpose of slightly lowering blood sugar, but I only use them for curbing overeating. The greatest success that I've had has been with the 2 injectable drugs, Victoza and Byetta. I'm going to use brand names because that's what I know in my head. Victoza is advertised for use once or twice a day, and that's how I use it. It starts working in about 1 to 2 hours and lasts about 4 to 5 hours. I focus it upon the time of the day that the person is overeating. Now, some people will say, I only overeat when I go out to eat. If that's the case, I don't use a relatively long-acting agent like this. I will use Stimulants, which is a copy of human amylin, a hormone, and this works more rapidly, starts working in perhaps a half an hour. It's also injectable. So we might inject some Stimulants a half hour before you're going to walk into the restaurant. And hopefully you won't ask for bread on the table, or if there is bread on the table, you'll ignore it. There are other medications in the Incretin Mimetic class that usually are not as effective. For example, Sam, do you know the name of the agent that you take once a week?
Yeah, Trulicity.
Okay. It's getting a lot of publicity, tremendous amount of advertising for a once-a-week injection of a substance that is going to lower your blood sugar a tiny amount, maybe lower your hemoglobin A1C by 1/3%. Now, I have only one patient taking this because I'm trying to focus on time of day. But this person travels around the world. His time of meals, time of sleep, etc. is constantly changing, and he asked for something that works all day long for a week. And to my surprise, it has curbed his overeating. He has no longer any problem. So I'm really amazed by this. I'm reluctant to use it on someone who doesn't have this traveling problem because the Victoza and the Byetta are so effective. The Byetta may start working in an hour and work for about 3 or 4 hours. There are other products in the Incretin Mimetic category called CPP4 inhibitors. These are oral agents that destroy CPP4, which is the agent that destroys the GLP-1 agonists like Byetta and Victoza. By destroying the agent that destroys these substances in your blood, supposedly these substances are around longer, but the oral CPP4 inhibitors don't seem to have any effect on appetite. They slightly lower blood sugar, less than the injectables, and thus far in my experience have no effect upon appetite. I haven't tried them very often because when I first tried them, they didn't have any effect, and I figured I'd stick with the injectables, which are certain to have some effect, almost certain. Now, the next category that we're going to look at...
Well, what's important, I think one important thing to mention with the Incretin Mimetics is that you should always follow up like you do with all of your patients that take Incretin Mimetics, whether it's Victoza or Byetta, is to always follow up with blood tests for lipase and pancreatic amylase.
Right, good for you.
Because that can be a side effect.
See,
it's pancreatitis.
That's why she's my sidekick. Because what I forget, she remembers.
Which we always do.
Contrary to the claims of the American Diabetes Association and claims of recent studies that these agents do not cause pancreatitis, I have already had 2 cases of pancreatitis within a month of starting people on this. And I therefore check for pancreatic amylase and lipase in the blood of all my patients who are taking these agents. We, if possible, will get a baseline before they start, and then at the end of the first month, and if we have no increase in the first month, we might check it 2 or 3 months later, and if we still have no increases, we might do it once a year. So this is pretty essential. Doctors are not doing this. They're taking the word of the ADA that there is no pancreatitis, and this is just not true.
And also, one of the main side effects is gastrointestinal.
Oh,
And
yes, slowing.
that's what people complain about, I think, most frequently as far as side effects.
Okay.
And that tends to go away within a few weeks.
Now, these agents, because of one of their basic properties, and we've discussed this in a prior video, slow stomach emptying. And if you already have gastroparesis, you may have unpleasant symptoms. Also, the gastroparesis may become more severe. Now, frequently, I have to decide which is worse for this particular patient, their overeating or their gastroparesis. Right. And in more cases than not, it's the overeating that's a bigger problem on their blood sugar. So I use these agents even though they already have gastroparesis. And it's a matter of judgment. By the way, I should have said at the beginning that this video is probably mostly for physicians, because physicians are the ones who can prescribe the pharmaceutical agents. We're going to get into some supplements later on, which people can pick up without a prescription, but this is the story. And if you're not a physician but have a physician, you can hopefully talk him into trying the various agents that we're going to describe if you have an eating problem. Okay, the next category is going to be what? Stimulants?
Stimulants, but the ADHD
the
stimulants.
Type, okay. Yeah. It was discovered long ago that when children with attention deficit hyperactivity disorder were given certain stimulant drugs, that they stopped eating. So we try to make use of these drugs, hopefully to curb overeating in those people who don't respond adequately to the Incretin Mimetics. Now, I should clarify this in one way. People can develop a tolerance to Incretin Mimetics. Mm-hmm. Over time, some people, I would say, what, a third of them or a quarter of them?
I'd say about a quarter.
About a quarter of people who use Incretin Mimetics find that they become less effective and eventually stop working. Now, it's possible to switch between Incretin Mimetics. For example, a person may become tolerant to Victoza after a year, and we switch them to Byetta, mm-hmm. and lo and behold, it works. And it might work for a year, it might work for 3 months, and if we're lucky, we can switch back to Victoza, but not with everybody. So we have in our storehouse things that are not Incretin Mimetics, such as the stimulants used for ADHD, which work by a different mechanism, and I might add that any appetite suppressant that we use may cause tolerance after a while and may not. It all depends on the individual and on the agent. So it's all trial and error. So what do we use in this category?
So one of the first ones is Adderall, which is I guess the generic name, or amphetamine salts. And that tends, I think that we've seen that it was effective in a lot of patients. However, the side effects can be really, I tried that myself, and it gave me some heart palpitations and fluttering, so I stopped taking it right away.
And you can also get insomnia?
But it affected me immediately, within 30 minutes of taking it.
Oh,
some patients it takes a couple of hours. It depends on the person. I think with any of these drugs, it depends on the individual.
Okay, so that's important to know. Mm-hmm. What other stimulants are there that we've
Ritalin, which is methylphenidate. Concerta is also methylphenidate. The generic is methylphenidate. And those, I tried the Ritalin as well, and it had the same effect on me. But they have worked for other patients.
Okay, so this is a whole class of medications that works on many people, not on everyone.
Right.
Some people will develop a tolerance to them, some won't. Some will get side effects, some won't. So if you get side effects, you stop it right away.
Right.
Now, is Stacera in this group?
Strattera is it's an ADHD drug, but it's the only non-stimulant ADHD drug on the market.
Is it really a non-stimulant,
Yes.
or is it less of a stimulant?
No, it's a non-stimulant.
Aha. Okay, so that's interesting. And we have tried that.
We're trying it on a patient right now that nothing else has worked for.
Okay. Okay, that's Peter.
Yeah,
Okay.
exactly.
All right. So you can see that we're very busy with these agents because we're dealing with probably the main cause of type 2 diabetes. So outside of the stimulants, what's the next category that interests us?
Well, we didn't talk about glucophage or...
Oh, yes, we should.
Yeah, that's important.
Glucophage...
Or metformin.
Well, the generic name is metformin, but as far as blood sugar lowering goes, I have found that generic metformin does not work very well. The original brand, glucophage, is much more effective. That's for blood sugar lowering. But it can also curb overeating, not by reducing appetite.
Right.
And I don't consider it a major player in this regard. However, if you want to use glucophage to treat blood sugar, keep your eyes open because it might also help you by curbing overeating and carbohydrate craving. So it's in there. It's not as powerful as the Incretin Mimetics and possibly even some of the stimulants.
Right. And then there's more anorectics. Some new ones that we've recently started using. Belviq is one.
Yeah, now the new ones that are, again, highly publicized,
right,
are mixtures.
Well, yeah, the Belviq, which and the generic name is lorcaserin. That hasn't been effective on a lot of patients, I think, because you really have to take the drug for 12 weeks to make sure it's working.
Okay, this is it's a serotonin serotonin 3.
It's a receptor agonist. Yeah.
Oh, is that it?
Yeah.
Okay, so like the old SSRIs, as they were called, like Prozac and so on, I think, which worked on, I believe, the serotonin receptor number 1. This works on serotonin receptor number 3. 2. Number 2?
Yeah.
Okay. Good for you. Boy, am I glad that you're on with me. So Belviq, which is getting a lot of publicity, only works if you wait at least a month. For some people, it could be a month and a half or 2 months. And
they tell you to stay on it for 12 weeks to see if it's effective.
That's 3 months. Okay.
It's a long time. And we've had one patient that was really successful, or a patient in Australia.
That's right. And she's very happy.
Right.
She can't believe the changes that have been wrought on account of this. Now,
makes you feel full and promotes like satiety. That's really the way that, I guess, works.
Okay.
And it worked for her beautifully.
So here we have Belviq gets tremendous publicity. Thus far, we found it working on one person.
Right.
And for her, it really works well. Now, Belviq is not a mixture of agents. It's a single agent.
Right.
But
And most people don't want to, wait 12 weeks to get a result. I think that's maybe part of the problem.
that could well be. Yeah, they stop after a few days
Right.
and say it didn't do anything. And that's not right. That's not the way to use it. Now, there are some other drugs getting a lot of publicity that are mixtures.
Right. Quizmia is one of them.
Okay, now Quizmia is a mixture of what?
It's a Topamax, which is an anticonvulsant,
Right,
and phentermine.
right. Now, phentermine is an ancient stimulant. I shouldn't say it's ancient because the other ones we've mentioned earlier, but I was using phentermine about 20 years ago when it was called was used with another drug.
Fen-phen.
Yeah,
Right.
they were called fen-phen.
Right.
And phentermine is a stimulant. It's reasonably benign, but a manufacturer thought, well, if I combine the relatively mild effects of phentermine with another agent, topiramate or Topamax, maybe we'll get a combined effect. And I have not prescribed this because Topamax has a long list of adverse effects. I believe it has adverse effects on the eyes. I think it can cause glaucoma. And do you know what some
seizures? Yeah, there's a list of.
There's a long list,
yeah.
a mile long.
Right.
So I'm sort of fearful of this drug. I already forgot its name.
Quizmia.
Quizmia.
And I don't think you've prescribed it at all
Yeah.
for that reason.
Yeah. So I'm staying away from it. It's highly advertised. Is it going to be a good seller? I don't know. What else do we have that's
Contrave, which is a combo of Wellbutrin, which is the antidepressant, and naltrexone.
Ah, yes. Now, we neglected to mention Wellbutrin all by itself.
But we have a list of
It's
the
another
antidepressant.
Group. Okay.
Yeah.
Yeah, there's another group of antidepressants that we'll talk about. But this particular mixture
For Contrave,
of Wellbutrin and naltrexone is sort of interesting because I got a patent years ago on the use of naltrexone to curb overeating.
I should bring it out.
You want to bring it in?
I can.
Okay. We have it hanging on the wall, and I let it lapse because I didn't know how to market the concept. I'm not a marketing guy. I was in a prior career, but I don't have time to market things. So we let the thing lapse because they were charging me $600 every few years.
We do have to show this.
Okay, there we go.
I don't know.
There it is. Okay.
So there it is.
Now, I had tried low-dose naltrexone, about 4.5 milligrams at bedtime. It stimulates endogenous opiates if you use it in the manner that I used it. What it did was block opiate receptors at night while you were sleeping, if you took it at bedtime, and you wake up in the morning and the body felt a need for opiate stimulation, and the production of endogenous opiates would go way up, stimulate the receptors that were deprived while you were sleeping, and take away hunger in some people. I have one person who's still using it, Helen, I think, I did not consider it highly effective. It was somewhat effective. I never tried the high doses that are being used in this new drug, which is
The Contrave?
Contrave.
Yeah.
So I believe they're using this all day long. That is, maybe, was it once a day or twice a day?
For what, the Contrave?
Yeah.
I think it's once a day.
Once a day?
Yeah, I'm not positive.
And they're using it in a...
And Belvique also is once a day.
Okay, so Contrave is naltrexone
And Wellbutrin.
and Wellbutrin. I know that Wellbutrin works for many people, and apparently the combination seems to be effective in clinical trials. Have we tried it on anybody?
What, the Contrave?
Yeah.
No.
No. So we haven't used it
No,
yet.
we haven't.
But it's an option.
Right.
When you have a seemingly hopeless situation where a patient is overeating and they're diabetic, it's a very dangerous situation, and you grope for anything that might work, and certainly this is worth trying.
There's actually one other drug that I actually discovered from our pharmacist.
Ah, yes.
Which is diethylpropion, which is
Related to Wellbutrin.
right, which is very close to Wellbutrin. And from what he's seen, it's probably the drug. I asked him, what do you prescribe the most from your pharmacy? And he said that's probably the weight loss drug that he prescribes most.
Okay, so Wellbutrin is bupropion,
Right.
and this is
Diethylpropion.
and diethylpropion.
Right.
So we're going to probably be trying it
Yeah.
when we run into a problem, and
Maybe good for Peter.
yeah. Peter's been he had favorable effects from GLP. One agonists, injectable agonists, Byetta and Victoza, for about a year
Right.
each, and then they stopped working, and neither of them is effective right now for him. So
We've
we're
tried
groping for...
Yeah, probably like 5 other things
Yeah.
since that haven't worked. So maybe that would be, I'm going to make a note.
Yeah, right. So we thought we had finished when we were speaking about diethylpropion, but I decided to look it up on the internet and found a surprise. It had the same brand name as a product that I had used for appetite suppression about 20 years ago very successfully. This was long before the Incretin Mimetics, so when they came along, I jumped to try them, and I left this poor product sitting in the background. And diethylpropion also had the brand name Tenuate and Mazindol. The brand name that I used on my data sheets was Tenuate, Tenuate, and it was very successful for me, or for my patients. Now, Tenuate comes in 2 versions. The dose span, or timed release version, has 75 milligrams per tablet, and you take it once a day. For most people who have eating problems limited to certain times of the day, like after dinner or whatever, we can use the rapid-acting Tenuate, which comes in 25 milligram tablets, and you take the 25 milligram tablet about an hour before you expect hunger pangs or problems, and it'll be working rapidly. I have several patients since this session trying the rapid-acting Tenuate, and one person, for example, has to take it twice a day. She gets hungry when she comes back from work in the late afternoon, and then gets hungry again after dinner. So she takes it twice in the afternoon and evening. Other people may only take the rapid-acting once. One thing they have to watch out for is not to take it too close to bedtime, because it is a stimulant. we were confused. Tenuate has the chemical name diethylpropion, and Wellbutrin, the antidepressant, has the chemical name bupropion, or bupropion. So we thought that they were related in terms of effects. No, one is the stimulant, the Tenuate, and the Wellbutrin is an antidepressant. So since Tenuate is a stimulant, you don't want to take it too close to bedtime because it might keep you up, and you can experiment with taking it earlier and earlier in the day, hoping that it'll start working soon enough but not keep you up at bedtime. Before you sign off from this session of Diabetes University, take a look at my book, Diabetes Solution, which you can view at the site listed below, or you can purchase from any online bookstore. Also, visit my monthly seminars, teleseminars. The site for getting these free seminars is listed below. You can also join the Diabetes Forum, where you can ask questions to other diabetics who have read my book and have been using it. And one last thing is, if you go to the teleseminar, you can ask questions which I will answer, if not the same month that you ask the question, within a month or two thereof. Thanks.